My name is Onkele Mtwame. I am from Botswana, and 10 years ago, I started on a journey of hope. I signed up as a volunteer at Journey of Hope Botswana, a nonprofit organization dedicated to taking free breast cancer screening services to underserved communities throughout the country. Over a period of 10 years, I grew from volunteer to leader, helping to change the story of cancer from one of loss to that of hope, and strengthening the NGO's role as a key civil society partner in Botswana's healthcare system. When I joined the NGO in 2015, our messaging was targeted at women who were 45 years of age and older, and we spoke predominantly of breast cancer as a hereditary disease. A lot has changed in 10 years. Breast cancer is now one of the most diagnosed cancers worldwide and the leading cause of cancer-related deaths amongst women in Botswana, largely due to late detection. Additionally, partnerships between Botswana's National AIDS and Health Promotion Agency and civil society organizations like ours have evolved health messaging to acknowledge the rapid rise in non-communicable diseases such as diabetes, heart diseases, chronic respiratory diseases, and all cancers, which collectively accounted for 46% of all deaths in Botswana as early as 2019. 2019 was also the year that I was privileged enough to be invited to join a couple of WhatsApp-based cancer support groups. Before then, our role as an NGO officially ended with linking diagnosed patients to care and reporting awareness and screening statistics to the National Health Registry. In 2019, the World Health Organization also formally recognized that mental health conditions belong within the NCD category. This is how the inspiration for my leadership project was born. It begins with Hope's story, a young woman in her mid-30s who is diagnosed with stage 3B breast cancer. Feeling alone in her diagnosis, she uses the free Wi-Fi service at her local clinic to join a local WhatsApp support group for comfort. She's met with an ongoing thread of rest in peace messages, which she finds stressful and leaves the group. Weeks later, she returns to cheerful birthday gifts and miracle cure chain messages and is not sure how to adapt to this new shift. Hope's experience illustrates how informal digital support spaces, whilst accessible, can become emotionally unsafe spaces without guidance, unintentionally amplifying stigma and mental anguish for its users. Solo Fellow, which is Setswana for Hope, is a digital pilot project to provide psychosocial support for cancer fighters, survivors, and caregivers in Botswana. It is piloted through engagement with an existing cancer support group called Love and Support, where the predominantly female membership are invited on a co-creation journey to allow for the crafting of customized and credible support. The aim is to grow it exponentially from there, using the advantages of a channel to share mental health, art therapy, and survivor storytelling support, helping families to deal with the trauma, stigma, and grief linked to navigating a cancer diagnosis. The pool of speakers contributing their skills and knowledge is drawn from allies that I have engaged with over the past 10 years, including general practitioners, oncologists, dietitians, and mental health experts, armed with first-hand experience of the unique healthcare challenges faced by patients in Botswana. It also includes my peers from the Southern African Women Lift Health Leadership Cohort, whose diverse insights and experience help to enrich the engagements. Key insights from the sessions are summarized and digitized in both English and Setswana and shared through the WhatsApp channel, where followers are free to react and reshare. At the end of the pilot, findings will be shared with stakeholders, including the Ministry of Health, and opportunities to collaborate and expand the channel reach will be explored further. My leadership journey has shown me that real impact starts with authenticity, grounding my work in the lived experiences of women and girls. I have learned to be inclusive by creating approaches that respect different literacy levels and allow diverse voices to guide the conversation. I've become more strategic by reaching out to allies and using existing technologies to reach people where they already are. Above all, I've learned that leadership must be impactful, strengthening coping skills and offering meaningful support to those we serve. By combining technology, empathy, and visual storytelling, women and girls can have their lives changed forever. As doctors become healers, Survivors become storytellers, art becomes therapy, and caregivers also get support. In conclusion, Solofelo has truly allowed me to make space for others and empowered me to claim mine as a leader.